Hey guys, so today I'm going to be covering a presentation that I just completed on the issues regarding the COVID-19 vaccination efforts. My name's Cailyn Whittington, by the way. Okay, so first, all right, so we're going to talk about my thesis, which pretty much is on a global scale, the COVID-19 pandemic really changed the way that we lived our everyday lives, changed the way we worked, the way we travel. Since the beginning, we've lived in kind of a constant fear of reigniting a pandemic after the chaos that we really experienced with the last one. And that fear is really still present, though it has, gone away a little bit. Anyways, this just so happens to not only represent the concern that we share on a personal level, but also how we function on a diplomatic level. We have seen how countries kind of work together. We have seen a change in those conversations, really from focusing on uh, trade and war and even aid. We've seen those kind of change focus into kind of zooming in on the COVID-19 pandemic, making it a running issue and one that is really necessary to discuss. Um, quite within the last 4 years, a focus on vaccinating the world has emerged as, a major health concern, and really one that is kind of shaping our global economy, health, and also our diplomatic relationships as well. So throughout the course of this presentation, I'm going to cover a couple of things, including rapid production, comparison between the United States and Burundi. You'll see within the next slide that this is a really kind of a drastic comparison, but one that is necessary to really understand um, vaccine inequality and why it's such an issue now. I'm going to cover the Pandemic Data Initiative, the economic cost of the COVID-19 vaccine, and also the ethics of contact tracing. These are all minusing, obviously the comparison between the United States and Burundi, but the Pandemic Data Initiative and the ethics of contact tracing, these are really uh, programs that are kind of put into place to better uh the outcome of the COVID-19 pandemic, and we'll kind of look at some issues that were created as a result of these. So firstly, we're going to talk about rapid production. So the coronavirus, it really kind of came on strong. It was quick and it infected a lot of people very quickly. So we really needed to create something fast in order to try and mitigate or try and curve the death toll as much as we can. So we'll see within the first year there was a drastic success because there were hundreds of vaccine companies around the globe that were putting in tons of money, tons of work hours to create something. And in the United States, we've seen three kind of front runners, which are Pfizer, Moderna, and Johnson and Johnson. And that quick development really helped the world. Now, the problem is that vaccine development was quick, but what about vaccine equity and vaccine equality? Globally, there are higher vaccination rates in higher income countries and uh, lower vaccination rates in lower income countries. As we see in the graph demonstrated on the right, this graph includes the top 10 most vaccinated high-income countries and the bottom 10 low-income countries. We can see Qatar is ranked at number one, with 105% of their population vaccinated. And then, of course, the last case is Burundi. Burundi is 0.01% vaccinated, so very, very low. And so this is just a drastic comparison. I'll go more into depth within the next slide. But one kind of big concern is that among the seven continents, Africa really continues to demonstrate the lowest vaccination of its people. And this just raises the concern of vaccine inequality even further, um, especially in regards to how developed your country is. So, a comparison between the United States and Burundi. So, by October 2021, we really saw that nearly 60% of the American population had been vaccinated. And this is in comparison with Burundi, which, in regards to around the same time, only 0.27% of the entire population of Burundi had received only one vaccination. And so, yeah, this is obviously a drastic concern. It is a very, very large difference between the two countries. As you see in the figure on the right, Burundi is it's a very small African country in the central part of Africa. And so really these statistics really raise the concern of why is this happening and what can we do to prevent this from happening or help, And some of the big concerns is that between March and September of 2021, there were around 15 million COVID vaccines that were wasted. And this is drastic because those 15 million, vaccines could have gone to help somebody, and instead they were thrown away in the trash. So, and then also another big concern is vaccine hoarding. It's Doctors Without Borders really estimates that around 500 million extra doses of the COVID-19 vaccine are hoarded within the United States. And that's quite a big comparison um, with, vaccine scarcity and vaccine wasting and vaccine hoarding located in Burundi specifically, but also on the continent of Africa. Um, when comparing these two countries, I know I mentioned in the last slide that like high income countries were more likely to receive a vaccine and have a higher percentage of their population vaccinated. And so I just like to really throw a figure out there. The GDP per capita of Burundi is around $250. In comparison, the GDP of the United States is around 85,000. So very drastic. This just shows the difference between a very, very, very poor and developing country and a very rich and developed country, and kind of the benefits that come from coming from a richer country have, you know. So we're going to move on. We're going to talk about the Pandemic Data Initiative. The Pandemic Data Initiative was created by Johns Hopkins Hospital, and because it was created because it was believed that many of the issues that were occurring in national and international responses to the pandemic were occurring because of poor data. Many countries and organizations really still relied heavily on data to make decisions based on the best interests of the public. Um, and some of these issues that initially motivated Johns Hopkins to create this organization are really still present today. Um, they're very relevant in our global community. Some of these including data infrastructure in the United States specifically, it's underfunded and understaffed. And these, working in a facility where you're underfunded and understaffed, that can ultimately lead to employee burnout, which of course, in regards to this, it does. And so I just really like to point out that, vaccine inequality is really a global issue, and that's my main overarching theme of this presentation. But also, what really helps develop a great vaccine is great data collection as well. And, data collection can really help us prepare, it can help us act, it can help us survive ultimately. Um, and yet, in regards to this initiative, something that would have helped us solidify all the data collections, at least in the United States. It's a bit of a failure that it was kind of shrugged off, and states ultimately just led to continue to partake in their own data collection. And I think that kind of leads to misorganization and either even further burnout on a state level as well. All right, so we're going to talk about the economic cost of COVID-19. So as we've known, and as we've seen the effects of, the pandemics are very expensive. Um, One example of this is the cost and economic value of the creation of vaccines. There was really a global effort in creating working vaccine that returned life back to normalcy. And in a result, hundreds of vaccines were developed. Um, and so, yes, vaccine rollout costs include labor, storage, transportation, program management. These are very expensive costs that can add up quickly. So, a big question, how did they pay for it? How do these countries pay for it? How do these high income countries pay for it? How do low income countries pay for it? Well, in regards to the high income countries, many of them really signed deals where they would cover procurement costs and secure themselves a stock of the vaccine. So that's a great deal for them, right? They aid with research and development. They cover procurement costs, and in return, they, get rewarded with their own personal stock of the vaccine to help their people. That's great. But obviously, low income countries can't really contribute to that. So, in regards to that, the World Health Organization created a program called COVAX, which was really an attempt to promote equal and affordable access for everywhere in the world to the COVID-19 vaccines. And this, program really incentivized vaccine manufacturers to work with poorer countries. Now I can't really speak on how successful this program was, but I think it was a good step forward in the right direction of really trying to promote a vaccinated world. And yeah, I think it was a great step forward. All right, so let's say we're going to talk about the ethics of contact tracing. This was really one last issue that the COVID-19 pandemic led us to. So in order to kind of move forward with this issue and resolve it, many people and government agencies created a comprehensive and cohesive response plan. And this really kind of focused on access to testing and its necessary of being widespread and accessible for all. Support really needed to be provided to those that are required to isolate. And lastly, like transparency is necessary between government officials and the general population. So I think going forward, one thing that they've learned is that decisions need to be made off of evidence and they should be decided and monitored carefully. A second and really a major principle is governmental transparency and accountability. Transparency is necessary on all levels to really create a relationship that demonstrates trust and confidence between the public and the official. A major really concern that we've seen of many Americans throughout the COVID-19 pandemic has been governmental infringement on our rights and civil liberties. This has been such a fear that for some, they have refused to mask, they've refused to vaccinate because they felt like it was impending on their rights. Um, I think really, in order to navigate this as an official, you have to avoid really kind of infringing at all. And that's hard because, someone could say, oh, you're infringing on my rights, but really kind of demonstrate a commitment to equality and equity, and just kind of taking care of those rights and understanding where that person is coming from. So, in regards to my analysis, I believe that the coronavirus was a new experience that the world was not necessarily prepared for. In response to this, there were many issues regarding navigating vaccine rollouts and inequality, gathering data that was necessary for vaccines, the effects on the economy, and lastly, like really the ethics of it all. Um, Though our experience with this virus was unique, I believe that it will drastically prepare our world for the next modern day pandemic. Not if it happens, but when it happens. There we go. Thank you guys.